Okay, so hi, I'm Brooke.
I'm Harrison.
It's nice to meet you. I'm going to be your personal trainer for your exercise thing that you're looking forward to. Before we begin, we're going to have to fill out a couple forms, just policies, stuff like that, in case something were to happen, stuff like
Okay.
that. So the first form I'm going to go over with you is the health history questionnaire. It's going to ask you a couple questions about your own personal health and then some family history health and stuff like that. So we can see if you might need to be sent to a physician before we begin our training. It's also going to tell me things we might need to watch out for while you're exercising so we don't push your body too hard. You're only going to need to fill out this top box right here,
All right.
and I do have the rest, so you can just quickly fill that out for me.
All right.
And if you have any questions, just let me know. I'll be happy to answer them.
Thank you. All right.
Okay, thank you. And so our next form is the Part Q, which is also known as the Physical Activity Readiness Questionnaire. It's going to ask you questions about some more medical problems, but while during exercise. It's very similar to the health history questionnaire, just associated with more exercise-related questions. You're only going to need to fill out this top part here, answer yes or no, and after you do that, I'm going to explain what happens during this bottom part. So if you would do that for me, and also if you have any questions, just let me know.
Okay. I think I got it.
Okay, so since you answered no to all of these questions, it basically means that we don't have to send you to a physician, which means you're practically cleared to do it. So if I could just, I think, get your signature down here at the bottom. Yes, if I could get your signature down here at the bottom, signature and then name and then date, and then I'll sign as the witness.
Okay.
Okay, thank you. Our next one is the informed consent, and I printed out a copy for you and me so we can look at it together. And this form is basically covering the major parts are the fitness assessments I'm going to take you through, risks and discomforts you might experience while we're doing these, responsibilities of yourself, benefits to be expected, and questions, and then finally at the end you're going to sign your consent. So I'm going to go into more detail now with how this stuff is. So obviously the basic of this test is to determine your fitness levels. A few of the tests we're going to be doing is body comp. I'm going to use a skin fold caliper, and it's going to measure your fat-free mass and your fat lean mass to basically measure body composition. It's going to be done 2 to 3 times, and it's going to involve the pinching of the skin. If you're not comfortable with taking your shirt off to do this, it's fine. We can do it through clothes. Next, we're going to be assessing cardiovascular fitness, which is going to be on a bike, or also known as the cycloergometer. It's several 3-minute stages that are going to be testing VO2, which is the amount of oxygen you intake during exercise. Shouldn't be too complicated. Unless you feel discomfort, we can stop the test at any time. We're also going to be testing muscular strength and muscular endurance. It's going to be several efforts to do maximal and submaximal efforts. So planks, push-ups, sit-ups, flexibility, hamstrings, stuff like that, to test all of that. And then finally, for flexibility, we're going to be doing the sit and reach test, which is going to, since it can't measure all the flexibility of your whole body, it's going to be measuring the flexibility of your lower back and your hamstrings, and that'll kind of give us a good idea of where you're at for that. Moving on to some possible risks and discomforts. There are the risk of changes during exercise with anybody. Some of abnormal pressures could be blood pressure, you could faint, you might have an irregular heart rhythm. Very rare circumstances include heart attack, stroke, or death, but that should not happen. Every effort and physical ailment will be made to make sure that this stuff does not happen. And if you're experiencing anything, let me know immediately so we can stop, because we don't want to have anything bad happen. And you may also experience some soreness and stiffness after some of these test stuff, because it'll be your body trying to get used to what we're doing and going through with this. Your responsibility, you possess the information that you know about yourself, so all of your medical stuff. If you know something's wrong with you, you can let me know. If you have pain, you feel some kind of pressure that doesn't feel right, you need to let me know during this so nothing bad happens and stuff like that. You're responsible for giving me your medical history. It's not going to go to anyone serious. It's going to stay between you and me, kind of like patient-client confidentiality. And the only time I would have to send it to someone is if something were to happen to you, so you don't have to worry about that. And if you experience any kind of symptoms, just let me know as well. Some benefits to be expected. It's going to show us your exercise capacity, and it's going to help me evaluate what type of physical activities are safe and appropriate for you. Any questions that you have about any of these procedures are encouraged. I want you to ask me questions if you're confused, because we want to make sure that this is the most accurate type of training session for you as we can, so we can get those benefits for you. And so here at the bottom now is where you're going to sign your consent to do all these exercise testing to your capacity, and you're giving permission for me to perform these tests on you voluntarily. So if you think that everything is cleared up and I've explained everything thoroughly, you can sign at the bottom there, please, for me. Okay, thank you. Okay, and so the last part, I'm just going to do a quick little interview to get some more information on you to kind of help out with what we're going to be doing here. It's going to give me an idea of what you like and kind of dislike as with physical activity, and just some more information that would be really good to know while we're doing this. So do you have any experience being inside a weightlifting gym, any type of gym at all?
Not much.
No, not really. What kind of physical activities have you done before, just in general?
A lot of walking, running, a little bit of lifting when I was working with athletic teams in college and high school.
Are there any that you favor over the other?
Not really.
No, so you kind of like all the same. Are there
Yeah.
any that you would not ever want to do?
I can't really think of one right now.
Okay. And if at any time you don't want to do one, just let me know.
Okay.
Are there any injuries that I should know of?
Well, 2 years ago I did have a foot injury, but that was back in 2017.
Has it been treated for?
Conservatively.
Okay. So have you had any surgeries that might kind of like restrict like some type of range of motion while we're doing stuff?
No.
No? What are your expectations to get out of this? So what do you want out of this?
Really just to like improve my just overall like ability and like strength, speed, agility, kind of a little bit of everything.
Okay. And those are kind of like your goals. Do you have like a certain set goal in mind for any of those?
Not yet.
Not yet. Okay, so I'll just put like general.
Yes.
Okay, so what does your schedule kind of look like? I know you're pretty
Well,
busy.
Yeah, it's a little hectic, but
When do you
Um,
think would be the best possible time for you to exercise? To kind of narrow it down.
probably in the late evenings.
Late evenings? Is there a time, like kind of like a starting time? What would be like a best starting time for you to like start working out?
Say 7 to 7:30.
7 to 7:30? Okay. And how many times a week
Let's say.
are you like free on that day with that time?
3.
3 days a week is
Yes.
when you're free that time? Okay. How are you motivated? How do you like feel like, okay, yes, this is it, we're doing this?
I feel like I'm both intrinsic and extrinsically motivated.
Okay. I think I have one more question. Okay, do you have any kind of worries or concerns that you want to express to me now that I can try and explain?
Just feel like to me having the like support and motivation from a good trainer always is helpful.
Okay, and that is everything. So it's nice to meet you, and I can't wait to start doing our sessions.
Thanks.